The average rate increase for covered California plans in San Diego will be 2.8%, which is less than the rest of the state's rate hike next year. But some people who have group medical coverage through their employers could also see a significant increase. Here to explain the rate changes are my guests, Gary Rado with the Council of Community Clinics and Jan Spenceley, Executive Director of San Diegans for Healthcare Coverage. And Jan, why are San Diego's rate increases going to be less than the rest of the states?
I think there are three reasons. One, we're a much more competitive environment. We have more doctors, more hospitals, health systems, community health centers. So we've been in managed care a long time. I'd say another reason, in general, for everyone, is that there's less risk this time. They have experience. When we first started Cover California, everybody was worried about the risk. This time they have experience. And I think the third reason is really that the plans with 40% of enrollment in San Diego already, they're the ones that came in low. So San Diego's average went way down.
I see. Well, who's going to be most affected by these rate increases?
I would say the people who were not in one of the plans that came in real low will see a bigger increase in their share of premium.
So the people that are in the higher premium plans already
Yes.
are the ones, and the people that are in assisted or getting assistance, they may not see as big of a hike.
The ones that are, they're all getting, a lot of them are getting
2.8.
assistance, but the ones that are in the plans, those two lowest plans, they're gonna be benefiting. Those other plans, the people in the other plans are going to see an increase.
An increase. I see. Now, Gary, this Covered California, staying on that. This is the third open enrollment period. What did you learn from the previous two that could help you increase enrollment this time around?
Well, one of the things that we know in this time is that this is probably the most difficult group to reach, those that are continuing to be uninsured at this point. We've learned that we're going to need to contact them many times. People don't have very much experience at this point in this group as far as what insurance is, how do you purchase it, what does that mean? So we've learned that we're going to need to do outreach to them, we're going to need to do it frequently, we're going to need to bring them in and work with them one-on-one, and we need to make sure that we can do it in a language that they feel most comfortable with.
Yeah, and same question for you. What do you think we've learned?
Well, I would add to what Gary just said is that, you know, about 2/3 of those that have not enrolled assume that Covered California or even Medi-Cal is too expensive for them, and they haven't even tried. They haven't even come and asked the question. And so what we try to tell people is at least ask before you turn it down, and maybe we can help you find something affordable.
And speaking of affordability, Gary, what do you do if you're having trouble paying your current covered health care plan premium? Is there something you can do for that, especially in anticipation of next year's increases?
Well, there are two things. One is if you're already a patient at one of our community health centers, you can come in and you can talk with the folks there and say, here's my problem, unable to pay my copay. Can't do much about the premium, but there's also the copay and deductibles. And very frequently we have a sliding fee scale that can then look at what person's income is and say what's appropriate and what approximately we're able to do to kind of discount that within the law. And the other thing to do is to shop around. Some of the plans are actually going down in price and premiums.
Yes.
So shop around online, come into the community clinic, things like that. Jen, I want to get to this employee-sponsored health coverage. They're expected to see an increase as well that may be passed on to employees. We're talking about small businesses here. What's driving those hikes, and who do you think will be impacted most by those?
Well, they're claiming what's driving those hikes is that they're having to standardize the benefits this year, like Covered California. And my question is, why? Why do you have to go up so high when in fact we've demonstrated through Cover California that it can be done more affordably? So what my advice to small employers, I've said this before, is blasphemy. If you get high rates and your employees really can't afford that coverage, don't offer it. It's an option for small employers under 50 employees. They don't have to offer it.
And then the employees would get their coverage through
get
Covered
subsidized
California,
coverage through Covered California.
I see. So Gary, when does open enrollment this year start, and also what's the calendar for people who want to renew?
Well, renewal will be October 1st. Open enrollment will be November 1st, and folks should be sure to ask and make sure, especially if they're new, that if they want to continue to go to a particular community health center or a particular physician, make sure they're part of the network of that particular health plan. And they can help you right there in the clinic.
And they can start looking now.
And they can call 211, they can call our offices. There are a lot of places, there are brokers out there. There's help, free help, and I want to say that over and over. Nobody should be charging you to help you. So there's free help available.
And they can start right now. They can start right now. We have to end it here. Unfortunately, we're out of time. So start right now. Get some free help. Jan Spenceley and Gary Rado, thank you so much.
Thank you.